can I introduce you to Dr. Sam Bennett, who's passionate about personalised care and support, and he's our Director of Think Local at Person.
There's an awful lot I could say in setting up this kind of conference, but I want to just say a few words really about where we started and where we think we've kind of got to. It's not going to be a kind of comprehensive narrative of progress. It couldn't possibly be in a few minutes, but just to give you a sense of where we think we're kind of up to today. To draw your attention to some of the work that we have done or are doing. We know how difficult it is to keep up to date with all the things that we put out there that we hope are practical and useful to you in your day jobs. But I just want to draw your attention to several of the things that we've put out recently, of which there are workshops that you can find out more about later on this afternoon. And then finally, just to say a word or two about this conference and what we're hoping to do and what we're hoping to get out of it. So, I mean, TLAP, you know who we are, I hope, and it's been 2.5 years, I think, since the first partnership agreement was published. We are a national partnership of some 35 organisations now that have a role in the implementation of personalisation and community-based support. And critically, that spans both central and local government. So the Department of Health are funders, but also signatories to that agreement and key board members. The LGA and ADAS are key board members with that as well. But critical, I think, is that we have provider organisations represented heavily across the partnership and their associations, and most fundamentally, as you'll see from the chairs that we have with us today, and for most of the workshops this afternoon, we have the National Co-Production Advisory Group, whose role is to keep us focused on the stuff that's important and that will help to make it real for people. 2.5 years in, these are some of the things we said that we wanted to achieve in our original kind of partnership agreement. I think that many of them are still incredibly valid. It's a journey that we're still very much on. This is a station, as Benson describes it, but there's an awfully long way to go. We're probably in Brighton, we need to get to Glasgow. There's a long way that we still need to go. There's lots that we can be positive about, I think. We have now more than 600 organisations signed up to making it real, that have made a board level commitment to transforming care and support through personalisation. We have most people, or a good number, depending on which measure you look at, onto personal budgets that are eligible for them. We have a care bill coming in with personal budgets being put onto a statutory footing for the first time, a duty for market shaping and around information and advice. We've seen some considerable and important changes in the social care market over the last period, as well as people have a wider range of services to choose between. But I don't think we can be at all complacent. We know, as I've said, that there is so much more that we need to do. That numbers certainly aren't everything. Just because we have more people on personal budgets doesn't mean we're making the changes in their lives that we all want to see, so that we can all kind of make it real. There is a long, long way to go beyond the numbers. There is significant national variance, both in take-up of personal budgets, but also in their use for all groups of people. In mental health, we still have a long way to go, for example. We have a long way to go in many other areas as well. And doing all of this at a time of really kind of significant budget cuts that I know are making our jobs all the harder is an incredible ask, and we appreciate that. There is a long way to go. Later on this afternoon, in a plenary that a number of our board members in Clenton again will be contributing to, we're going to engage you in a discussion about what are some of the things that we might need to do next. Accepting that we've made some good progress, but there is a long way to go, and there's an awful lot that we could focus on. What might we want to do that is most impactful with the limited kind of resource that we have. I want to say just a little bit about some of the things we've published, as I've said, and then to direct you to the workshops where you'll be able to find out more about them. And I'll start with the most recent. Last week, following the summit for personalisation called by the Minister that TLAP facilitated on his behalf, we published a series of documents looking at the challenge of reducing bureaucracy in the self-directed support process, and a similar piece that was looking at strategies around what works in increasing the uptake of direct payments. This is responding to the clear finding in a publication we put out earlier in the year, which is the National Personal Budget Survey, the second of those, that highlighted that the outcomes were good, but the process still has an awful long way to go. And that the single biggest determinant on people's outcomes with personal budgets is how easy or difficult it is made for them to access, use and manage that. So we've put some stuff out there. It is, as with all of our work, about sharing what works, about getting the solutions that we know are out there and making them more kind of practical and accessible for people so that we can apply them locally. So do, if that is your role or your day job, do have a look at those when you're back in the office, perhaps tomorrow. The workshop that we'll be looking at that, there is one, if you want to grab your kind of ticket for it, which is feeding back directly from the Personalisation Summit. We'll talk a bit more about some of those issues. The second one I'd like to pick out is that we've published a series of documents designed to support those within councils that will be tasked with new duties under the Care Bill in relation to information and advice. We published a series of documents in partnership with our host, the Social Care Institute of Excellence, that are designed to make that job easier. A set of common core principles for provision and commissioning of information and advice, a map looking at common customer journeys into the social care system and the pressure points within that at which it's most useful to have the right information and advice available. And our jargon buster, which has proved a particularly popular resource with 52 of the most common care and support terms translated into sort of regular sort of person speak. So do have a look at those, and there is a workshop during the course of the day where you'll be able to hear an awful lot more about the work that we've done and have planned around information and advice. The third thing I'd like to draw your attention to is the shared commitment to integrated care and support. TLAP were very proud to be signatories to that shared commitment back in May of this year, which provides a platform for taking forward incredibly important work around integration over the next 5 years. TLAP's interest in that is ensuring that we don't get lost in the system speak, that we don't just try and fix the system at a macro level, but that we keep focused on the things that are important to people. Integration without personalisation, in my book, will not be worth it. So there's a workshop looking at that, if you're interested to come and hear more about it. NHS England are speaking at that to give you the policy context, and we'll be hearing from one of our board members from Barnsley about the local experience so far in drawing together the agendas of integration and personalisation. The next thing I'd like to draw your attention to, we celebrated our 1 year anniversary of Making It Real in May of this year. One of the things we did there was to publish a couple of cohort-specific Making It Real. So there was a Making It Real for dementia published on that day, as well as a Making It Real for carers, and we've more recently published a Making It Real for young carers. We have some fantastic stories from organisations that have made that commitment and developed their action plans for Making It Real. There's a workshop that will be exploring some of those. And finally, back in March of this year, we published a framework looking at what we mean by quality in care and support, what it means, whose responsibility it is, and how we can assure and improve quality locally. And again, there's a workshop that will be looking at that in some more detail later on this afternoon with Bill Mumford, the chair of our National Market Development Forum. So please do come along to that. I'm going to do this very quickly because I'm mindful that we're a little behind time, but I wanted to draw your attention to a couple of headlines from our existing work programme, things to look out for, things that you can contact us about to find more about and get further engaged with. But to say that we are doing a number of things between now and the end of this year, and this is just a few of them. We are taking on the task of facilitating the coordination of an action plan from the summit around personalisation that will re-energise and reinvigorate the agenda around personalisation, and we'll have something more detailed to share along with key partners in ADAS, the LGA and the Department of Health on that by the time of the National Children and Adult Services Conference in the middle of October. We are this year trying to take our work out beyond the national space. We're an organisation with local in our title, but we're all national organisations seeking to make a change at local level. While we can never hope to have feet on the ground in 152 local areas, we are looking to work through the 9 ADAS regions to support and facilitate work around TLAP key kind of priorities in this year. So every region, I believe, is engaging with us in one way or another on that, and many of the people involved in that work are here today, so thank you. We are about to kick off a programme of work as part of our white paper commitments alongside Public Health England to provide a programme of support to health and wellbeing boards around community empowerment. We've done a lot of work over the last 2.5 years pulling together what we know works about building community capacity and looking at what the business case is for that. We're pulling all of that together into a comprehensive programme to support health and wellbeing boards to build community capacity and empower local communities. More about that you'll hear shortly. We're establishing, on the basis of the work we've done on quality, a national quality forum to coordinate and provide shape and leadership to the quality agenda. And in Andrea's new role as Chief Inspector of Social Care, we're expecting to have lots of work to do to support CQC in its role around developing aggregate ratings for providers in the next period. We are supporting the rollout of personal health budgets with a particular emphasis on integrating those across health and care and the huge benefits that can come from that. There is a workshop specifically geared at sharing some of the early learning around integrating at the level of the individual through personal budgets that you can choose to go to this afternoon. We are looking at shaping our offer into the shared commitment that I mentioned before. There will shortly be some pioneers announced up and down the country who will be moving at pace and scale with their plans around integration. Some of those will be doing so, at least in part, through integrating at the level of the individual through personal budgets, and many of them will be using the narrative and making it real to keep that work grounded in what's important to people. So we'll be doing plenty around that moving forward. We are about to start work in partnership with the Winterbourne View Joint Improvement Programme to model an approach to dealing with the Winterbourne challenge, people with very complex needs and behaviour that challenges, and we'll keep you posted on that. We expect to have a significant role in the drafting of regulations and guidance around the Care Bill, and we absolutely must keep momentum with making it real. And finally, on today's conference, this is our first conference, as I mentioned. It's been, I think, about 12 weeks ago we didn't know we were having a conference. So the fact that we've got here today and we have a room of such fantastic people to join us for this is an achievement. We feel that this is the right time to do something like this. We've been going 2.5 years, we should have plenty to share, and we feel that we do. So we hope that you'll find that the agenda for today reflects that and that you get something really useful and practical out of it. We've brought together a good mix of people. We've tried to focus today very deliberately on the elements of TLAP's work, the elements of our vision that we're striving towards that take us beyond the traditional kind of social care field into the wider kind of transformation that we want to see across the health and care system.